Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic, and we have a wonderful, exciting show tonight. But first, I would like to start with a scripture before we tell you who is in the house. Okay? I'm not by myself tonight. So we're going to do a reading from Romans chapter 5. Starting with verse 1 about faith, hope, and love. Therefore, since we have been justified by faith, we have peace with God through our Lord Jesus Christ, through whom we have gained access by faith to this grace in which we stand, and we boast in hope of the glory of God. Not only that, but we even boast of our afflictions, knowing that afflictions produces endurance, and endurance, proven character, and proven character, hope. And hope doesn't disappoint us because the love of God has been poured out into our hearts through the Holy Spirit that has been given to us. Hallelujah. I love that passage, that even in our afflictions and as physicians, that's what we try to do, is minimize people's afflictions. But we are justified not because we're wonderful people, but because we have faith and we have peace and endurance, and it builds our character. So tonight it's Wednesday, so we have Dr. Jeff Haddad. Welcome, Jeff.
I'm not the surprise guest.
No, you are not the surprise guest. We have a young, beautiful actress, stunt woman extraordinaire.
Oh, I love it.
Who has, wow, you should see her website, too. All the credentials she has. Her name is Sarah Holden. She's a hometown girl. Can I call you that?
Sterling Heights,
yes,
born and raised.
Born and raised. Sarah, thank you so much for giving your time to be on the show. I know how busy you are, and you fly to L.A. and Chicago and wherever, and now it's so neat that now you're doing some work right here in the Motor City.
That's right. Well, thank you for having me.
Yeah. So anyway, Sarah, we know that you have a beautiful smile and beautiful teeth. And I don't want to go to the cosmetic end of it, Jeff. Come on.
But, Joey, did such beautiful work on her. I mean, can we at least, give me a little attaboy on
Jeff,
that?
please, come on. Some other time, man.
All right.
No.
Well, I'll tell you, I brought Sarah for a couple of reasons. One, she has had a lot of dental work in her time.
Yeah.
And two, she's become a good friend of the family over the years. She's been a patient of mine for a decade probably. And
a decade of work?
A decade of, well.
Wow.
Can you believe it?
Wow.
I just think that I thought it would be a great idea to have her on tonight so that our listeners could hear her experiences in the dental chair. She's had a lot of different types of procedures.
Great. I like this.
Yeah, lots of different procedures, whether it be from removing some of her old silver amalgams to unfortunately having some emergency dental work done, which we'll get to. But I think it'd be great for us to just discuss some of her experiences in the dental chair. And I'm hoping she's going to maybe inspire some of our listeners who are fearful of the dentist, who maybe have been avoiding the dental chair, which a lot of us do, and maybe get them in and take care of their dental health.
Wonderful. Wonderful. So, Sarah, tell me, so I've seen you jump off tall buildings and do all these stunts. And so you've had a lot of dental work done then?
Yes, not due to my stunt work, though, believe it or not.
Not due to the stunt work, good.
No, not yet. However, I do have the doctor to go to when that does, in fact, happen. But no, actually, it's funny because I always thought I had a really healthy mouth. I brush, I floss, I eat healthy. I do all the things that I'm told to do, but, thinking back to all the times I went to the dentist, I always had to go back for a follow-up appointment to get a filling, a cavity. And this is when I was a young girl. And I just thought it was normal. Oh, I went for a follow-up, and now I have to go back for another follow-up, which really wasn't, because it was me getting a filling. And my whole mouth was fillings, actually.
Oh, and were they the good fillings or these?
Well, no,
amalgam?
the amalgam silver filling, the metal fillings. I just heard that the word was called amalgam. I just called them metal, the silver, ugly ones.
Well, Dr. Haddad and I had this topic of discussion. When you look on the label of food, whatever is the highest percentage is the first thing that they list on the label. And the first thing that's in the amalgam is mercury.
Mercury, yeah.
Mercury is the first ingredient, right? Well, Jeff, what percentage are the amalgam fillings?
I believe it is it upward around 60% of it is mercury fillings. And so, it's a material that's been used since the Civil War, and any other, area of medicine would never be proud of utilizing the same material or techniques or technology that was used 100 years ago. And so, I just, listen, I choose other materials because I know that they're safe and I know that they work better. And why would I choose to use a material that, in my opinion, is outdated and inferior to anything else that I could provide my patients? So, every dentist has their own opinion. And, I just saw a recent survey that we're probably going to talk about next week, Wednesday, that I think you're going to find a little disturbing on the percentage of dentists that still solely use amalgam in their practice. But, I think we're going to get to today the fact that when you do replace these amalgams, not only are you going to feel better, you're going to look better, you're going to feel healthier, and I think Sarah's going to help other people understand that today.
Yeah, well, it definitely does make us toxic, and it leaches into our system, and then So tell us, Sarah, what the listeners have heard Dr. Jeff and I talk. I want to hear you. So tell us, what are some of the things that you've had done over the years?
Well,
dental-wise.
Yeah, well, besides having all of my amalgam fillings replaced with, I don't know what's the technical term.
You've had different things. You've had, we've talked in the past, there's a couple ways there's 3 ways that we can fix a tooth for the most part if we take a silver filling out. If it's a small hole, we'll put in a composite filling, which is a plastic filling.
I think I have some of those.
You have several of those.
I think I have several of everything.
You do. You've got a smorgasbord of restorations. The second and the most aggressive is a porcelain crown, and that's when we have to, there's not enough tooth to really restore properly without covering the entire tooth with a porcelain restoration for coverage and strength, and that's a crown. And then there's something in the middle, which actually you have the most of in your mouth, Sarah, is which is called a porcelain onlay, and that's one of my favorite restorations because it's not as aggressive as a crown, but it's as strong as a crown. And what happens is we're replacing this lost tooth structure with something that's adhesively bonded to it that will actually reinforce the rest of the tooth. Dr. Joe loves when we talked about the amalgams that have this wedge effect, right? The wedge effect. Right. And the wedge effect that truly causes hairline fractures in your tooth over the years because it expands and presses on the outside of the tooth, causing breakages. And unfortunately, that's usually what amalgams do. They take the tooth with it when they break. It's not just the filling that breaks, but it's the tooth. And Sarah, how many intraoral camera pictures have you seen of your teeth over the years? I didn't have to tell you that there was a problem. I mean, when you looked at it.
Well, that's the cool thing about Dr. Jeff's office is when you go there, they put a camera on your tooth, and you can actually see all of these little hairline fractures he's talking about. I mean, I don't know what any of that is, but when I look at it, it doesn't look good. And the fact is you can see it right there, and I'm fixed up that day, and I walk out, and I have a whole new smile. And the thing is, it's beautiful. It also adds to your confidence. Beautiful. I smile a lot. And in my business, I have to smile a lot, and I'm getting pictures taken. And, I mean, when I got all of that metal silver out, and I felt like a new woman. I mean, I could smile bigger. I had this different aura about me. I was more confident. And that's at the end of the day, like Dr. Jeff likes to say, that's the most important thing.
That's his line.
It is.
Yeah.
But I think I got that from him at the end of the day.
Wow. Do all your patients say that now, Jeff?
That's how often I am there.
I give cue cards every once in a while when need be.
But it's true. I mean, the confidence shows. I mean, it's awesome. It is.
Well, the wedge effect. So of the amalgam, splitting the tooth. And I know we've covered this in the past. We've talked about how the amalgams start to crack along where it's bonded to the tooth and bacteria. Have you ever had a time where you had bacteria growing and where the amalgam got infected?
Yeah, should we talk about that? This just actually happened a couple months ago. I was in town shooting a film called Oz up in Pontiac.
Wow, you were shooting Oz?
Yeah, I was.
Next time you're shooting, I want to go. I want to watch this.
You can come to set with me.
I've got a son who would love to see this. Yeah.
Well, he can come too.
Yes, okay.
You guys can both
come. So you were
as my
filming
visitors.
Oz.
So I'm on set.
So wait. Who cares about your tooth? I want to hear about Oz. Wait a minute now. When is that being released? I want to.
And you can go to sarahholden.com for more information. No.
Wow, look at this. I thought Sarah was going to be talking about dentistry today, folks, but we'll get to that.
But for real, I get on set, and I had issues probably 2 days before, but I thought, it's just I don't know, maybe I thought it was just a toothache or maybe another cavity, which I have, but this was not going away, and it was just lingering, and it was getting progressively worse each day. And I started getting really scared, so I started taking, I don't really like taking a lot of painkillers, but I mean, I have to work all day, and I had to get through the day. So I was taking a couple Motrin, and it was doing nothing. So I called the office, and I talked to Dr. Jeff, and he says, that kind of sounds like it might be a root canal.
So could you repeat your symptoms again? It wasn't just pain, right?
Well, no,
you didn't just have a toothache.
It started off as a toothache, but then as the days went on and I ignored it, I started actually feeling physically sick. I had headaches.
But Doc, would you say headaches because of bacteria becoming systemic? So this is what we try to really educate our listeners, that these mouth issues, it's not just cosmetic. I mean, we need cosmetics, like you said. It gives you confidence and faith and belief in what you're doing. But also the mouth, you're getting bacteria going into your body. How can you, and now the answer is not come to Dr. Joe and get a vitamin or a bottle of this or go to the health food store. We need to take care of the root cause of the problem, to get rid of the bacteria and the viruses and the microbes and parasites that will start to grow and infiltrate not just your mouth but your whole body. Is that pretty?
No, that's perfect. I mean, really, what it comes down to is this, and Sarah, it's funny that we're talking about this because we talked about fillings that were starting to fail, okay? And, in the past we've talked about this. Most patients, if something's not hurting you in your mouth, why would you think there's a problem? I mean, it's common sense. Why would we think that?
Right. If it ain't broke, don't fix it.
Exactly. But unfortunately, patients who think that everything's fine and who aren't going to their dentist regularly, there are things that are happening and you don't realize it. And when it starts to hurt, it's too late. What Sarah unfortunately had happen was she had a silver filling that was leaking. She didn't realize it. In fact, there was actually a little fracture in it that she didn't even know happened. And leakage happened, got underneath it, and it did get infected. And unfortunately, at that point, when things start to progress, you are talking about a nerve problem. We've got the outside of the tooth, and then you've got the inside of a tooth, which is the nerve, which is the blood supply and nerve of the tooth. If that becomes infected, you have two choices. You either extract the tooth, which we don't like to do, obviously, or you have a root canal, which is unfortunately what Sarah needed that day. And when we have emergency patients like this, we rearrange our schedule, which we did for Sarah.
Oh, yeah. I called immediately, and I said, I am in so much pain. And, I mean, I'm a stunt woman. I think I have a kind of a high tolerance for pain.
She's a tough one.
But this was beyond, I mean, I couldn't drink a sip of water without wincing. It was just so sensitive to the cold. And so Dr. Jeff got me in right away, which was a godsend to me. And I went in, and you didn't actually do the root canal that day, though. You just We started
it. Yeah. So, unfortunately, obviously, on an emergency basis, root canal is a pretty involved, procedure. And so, but there are ways to get people comfortable and we do that. And we got her in, and we started the root canal is what we did. Unfortunately, we had to put her on an antibiotic at this point because it was allowed to progress too far. And, I think I'm hoping that our listeners who are listening, are sitting there who have had a toothache in the past and say, yeah, I won't make that mistake again because, Joe, luckily, has never had anything like that. You are a lucky man. I myself have had toothaches in the past, okay?
Joe, you've never had a root canal?
No. I've had some cavities, but I've never had a root canal.
Oh, my.
Having a toothache like that, I wouldn't wish upon my worst enemy. And people don't realize it, unfortunately, until it's too late. And so I guess the moral of the story here is, if it's not hurting you, doesn't mean everything's fine. Make sure you're getting in for your normal checkups. It's very important. And, Sarah, before I forget, I want to talk about your evolution as a patient, because when you first started coming to me, and you still are to a degree, I mean, I know you don't love having dental work done. Who does? But when you first started coming to me, why don't you tell our listeners your fears and what you were feeling even prior to coming to my office?
Okay, well, not a big fan of the dentist. No offense.
None taken.
I mean,
is that from childhood?
Well, it might be.
Or?
That makes sense because, like I said before, every time I went, I had to go back again, and I was getting drilled. I mean, this was when I was 5 and 6 and 7, maybe. I think that might be right, a little girl. So that could be why. But, I talked to a lot of my friends. No one really likes going to the dentist. It's not like a thing you want to do. But the one thing that I can say about Dr. Jeff is that they make you very comfortable. I do not like shots.
How is that?
Okay, for instance, I don't like shots, and a lot of this dental work I have to get an
stunt
anesthetic.
woman, and she doesn't like shots.
I know, it's shocking.
She's been punched, jumps off 2-story buildings through flaming hoops, and doesn't want a shot.
I can't win here, Joe. I mean, gosh, I'm doing my best, but I got a tough woman here, and she doesn't enjoy.
On the outside, I'm very strong, but when it comes to needles and stuff, I do not. I'm telling you, I do not like it. So
anyway,
that was my initial thing when I told Dr. Jeff. I said, look, all of this work you're telling me about, like, is this going to entail me getting shots and getting numbed and anesthetic? And he's like, well, yeah, it does. I'm like, oh no, I can't do it. And honestly, now I don't even mind it. He puts on this topical ointment that numbs you, and I'll leave it on for a couple minutes. He gives me headphones. I can listen to my favorite music. That helps. That helps me, at least.
No, that is the key. I mean, I learned this a long time ago. You want to take your patient's mind off of things. I mean, again, I know thyself. All right. I've been in the dental chair. I don't enjoy it myself either. So I cater to our cowards. And so whether well, hey, it's no offense at all.
No autograph.
I'm not that bad. I mean,
no, really, I mean, listen, Sarah, to be honest, you are like most people who are listening right now. Many people are very fearful of the dentist. They're afraid. Some people avoid the dentist solely because of the shot. And I love the fact that you mentioned the topical. The topical that we use, it is the best topical that is out there. And I've researched it all. And I'm not going to cut corners for my patients. Obviously there's a lot cheaper, less effective, ointments out there, but I want what's best for my patients. And
use a quality ointment, and then
it completely
how bad did the shot hurt when you got the shot?
No, that's the thing. You can't feel it. Like this stuff.
You didn't feel the shot.
It completely.
You didn't feel it at all.
No, I mean, there's a little. There might be a little pick.
Yeah. So how do you do? What's your technique, Dr. Haddad, for that?
Well, that's
steady hands.
Thank you. I was gonna say, I'm like, give me a little credit. It's not just the ointment. No, in all seriousness, I was taught, and I'll never forget this. Dr. Tom Verizor, one of my mentors at U of M, literally just told the class, said, listen, if you want to be successful as a dentist, learn to give a good shot. People remember that, and I've taken that to heart. And it's all about a very steady and very slow injection. And I had a great compliment today from a longtime patient of mine that says, honestly, I tell everybody, every single time I come here, I don't feel these shots at all. It's unbelievable. And it's a compliment. And I love to hear that. And, we want to put people at ease because patients stay away from the dentist because of these fears or even the idea of how bad it can hurt. But things have changed, people. Okay, we have better techniques, better products that make it a lot more comfortable. And again, we're going to take your mind off things. We're going to use things like music. We have massage chairs. We're going to put a nice blanket over you. Whatever it takes to make the experience as tolerable, and I don't like to use the word enjoyable because you're still in the dental chair, but as tolerable as possible. It's important. And so I appreciate you saying it, Sarah. And, why don't you, even, at the very beginning of when we met, you were even more fearful than most, and we recommended the nitrous gas, and that relaxes you.
Yeah, I think I needed that at first, but now, hey, I don't even use that anymore.
Well, that's my point.
I don't.
We've built you into a better dental patient. It's true. We have a lot of patients, honestly, Joe, and and like you and I share the same philosophy, which is I don't like to use medications and drugs if I can avoid it. But there are some people, as we know, that really have high anxiety.
Sure, there's a time for everything.
Correct. So, sometimes we'll use a Xanax or a Valium for some extreme cases. But again, then they start to realize that it's not as bad as they thought. And
they also psych themselves out, too. An hour before the dentist, they have their appointment, they'll get all freaked out, and they're psyching themselves out. But now, like I said, now that I've been going and Dr. Joe does have a steady hand and it's not as bad as I thought, I don't even think about it anymore. And when I go, I don't get anxious,
Hey, Sarah, can I ask you, so why, when you first saw Dr. Haddad, why did you want to get your amalgams removed? What was your purpose?
Well, two major reasons. And number one, I think I spoke about, but I didn't like how they looked. I mean, that's kind of a
cosmetic, sure.
A cosmetic thing. And I know it's kind of vain.
But industry you're in. But
I think with anybody, too. But I know, I already talked about that. But another thing is the cold sensitivity. And when
cold sensitivity.
My teeth started being so sensitive to anything hot or cold. And I just thought that was normal. I thought, I just have really sensitive teeth. Everyone says it. Yeah. I just have sensitive teeth.
And as Jeff, as you said, that's a sure telltale sign the amalgams are getting.
That is one of the red flag warning signs of these silver amalgam fillings failing. It is, you think about this, it's expanding. It's pressing on the tooth, and there's leakage happening. So if there's any cold sensitivity or chewing sensitivity, please see your dentist. These are early warning signs. You do not want to end up like Sarah did, who unfortunately, now think back now, Sarah. Did you maybe have some of these early warning signs, maybe even months prior to that, maybe you chalked up to, a little sensitivity and then it went away? And,
absolutely.
Yeah. This is common knowledge and common, occurrence with people. If it goes away, it probably fixed itself. But if you think about it, nothing fixes itself.
Jeff, I'd like to cut in here just because, like what you had, Sarah, just recently, where you had headaches, fever. It wasn't just the tooth pain. You had this systemic problem where all this bacteria and infection was going into your body, which was probably, for so many of the patients we have out there listening, you have a low grade of it where you might not even notice it yet, right? It's really not detectable, but it is taking away your energy level. It's suppressing your immune system for other things, where you might become more susceptible to a flu or sinuses or whatever. And we need to be a little more preemptive, right?
Absolutely.
Go to the dentist.
And I learned now because I wasn't myself. I was at work and, even people were coming up to me like, are you having a bad day? People were noticing. And I was, like I said, I was like getting sweat. I was sweating. I had headaches. I felt physically sick, like I had the flu or something. And I didn't realize that this was all caused of the bacteria that, the infection I had.
No, we don't want anybody to get to that point, Joe. And what you said is perfect. These little warnings, we're all very, very tough creatures when it comes down to it. Human beings can accommodate to a lot of things. However, hear me now. When you do have, say, a cold sensitivity on a tooth or chewing sensitivity, and it just goes away, it didn't fix itself. There's something going on there. Please do yourself the favor, going and getting it checked out. Hopefully it is. Sometimes you can come down on a tooth and, essentially bruise it. But 9 times out of 10, it's not that. It's something else that is starting, and you want to get to it before. Because if Sarah would have got to me sooner, we could have probably removed that filling, cleaned out the decay, put in maybe a nice either filling or maybe a non-lay, and avoided not only the pain, but the aggressive. Unfortunately, after a root canal is done on the chewing surface of a tooth, you need to put a crown on. I don't like to do crowns, as you know, but we have to for strength after a root canal. So because she waited, and it's not to make Sarah feel bad because that's a very normal thing. It's just to teach others, don't wait till it's too late, because unfortunately it's going to end up costing you more money and be a more aggressive procedure in the end.
Boy, there's not much.
Touche.
What do you have to say about that, Sarah? What?
I wish I would have called him 3 months earlier. It would have been a lot better for me.
Yes. Well, I like the idea, Jeff, that you're trying to do preemptive, before you need a root canal, or you try to do the onlays, which I don't notice, not many dentists do that technique, and that's a wonderful thing. But also, even if the amalgams are not a problem, they're still leaching into your system. It's still a very bad material to be, besides the cosmetics. Mm-hmm. So that's fantastic. I'm glad you've learned your lesson, Sarah. I guess it's
have
a lesson to all of us. Boy, Jeff, you're hard on her here.
Well, luckily I could speak frankly with Sarah, and she's a good sport. But, I honestly, I kind of came up with this idea a little bit last minute. But, Sarah is very like many of our patients out there. They have dental work. Dental work doesn't last forever. Unfortunately, I wish it did. It doesn't. So you have fillings that were put in as a child, or even in the last 10 years old. Materials don't last forever, and when they start to fail, let's take care of them before it becomes a real problem, where it debilitates you, causes infections, causes systemic issues. I mean, we have a chance to intervene if you let us. So think about that. Get exams from your dentist. If you're having an issue, go get it checked out. What's the worst case scenario? He says everything's okay. He or she says you're fine. That's good. It'll be a peace of mind for you then.
So there you have it in summary. If you have amalgams, please get them out and get a checkup before it's a major problem. And prevention is the best step of medicine, isn't it? Sarah, thank you so much for coming.
Thank you for having me.
And we wish you a tremendous amount of grace and good fortune for Christ to shine his light upon you in your whole career.
Thank you. I hope I inspired some people out there to go to the dentist, because I'm not a big fan, but you know what? At the end of the day, like Jeff will say, it's worth it.
Yes, we'll have to watch for you on Oz. And remember,
thank you.
In all that you eat or drink, do all things to the glory of God. And if you'd like to watch or listen to the show, go to our website, simpletruthsforhealthyliving.com, or call Dr. Haddad at Rochester Advanced Dentistry.
RochesterAdvancedDentistry.com, 248-656-2020.
Thanks, Jeff. All right, have a good night, and we'll talk to you tomorrow.
Sounds great.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.